I've heard this really great analogy for policy because I think it's the type of advocacy that seems a little more esoterical. It's harder to grasp and understand. It's not as comfortable. It can be a little bit more scary for all of us. But this analogy I've heard and I like and we'll use today too is, to kind of think of policy as like a playground in the sandbox that we all play in or live in or get healthcare in this instance. And policy are the pieces that affect that playground, right? Like policy is the playground rules almost. It determines what equipment is available, who can play, the safety standards, what's available for everybody. And as those pieces shift and change, the playground changes. So, maybe the swings are a super popular thing in the playground and there's not enough for everybody. So we put in another set of swings so that there isn't a long line of people waiting to get it. We hear this about access to screening and treatments and modalities that are advancing technology within the healthcare space. And sometimes things get outdated. I don't know if you guys remember those old, I'm dating myself, metal slides that would burn your legs if you went down. And policies are the things that get those swapped out for the newer plastic ones, the rubberized ones, all those kinds of things. It might not be something visible every day, but it determines our total environment around us. And so there's all the different players we know, patients and communities, the hospitals, the clinics, the providers, everybody that is doing the healthcare, the people and payers who are paying for it, insurance companies. But there's also some hidden players in there too. We have things like middlemen or PBMs, pharmacy benefit managers, and all these things that different policies, sometimes not even healthcare related policies, affect through budgets and things like that. So as all of that shifts, it affects not only community organizations like Tigerlily, but all of us. And so those things can determine, one, funding, very important, what's available. All these things cost money, unfortunately. And so sometimes they're funded by the government, sometimes they're funded by the state, sometimes they're funded by other entities. And as those budgets change through policy making, that affects what's available and who has access to what. I know like the Medicaid cuts recently in this newest reconciliation package, a lot of people are worried about that, and that's a big effect. So there's a lot of different ways that these things can affect not only access to care, again, that kind of slide or swing analogy, how many of what is available and how long access takes and if it's affordable, but also the general funding and support and infrastructure behind all of that.